If you're suffering from migraines and you've tried all kinds of treatments, you might have heard about something called migraine surgery, but you're wondering if it will work for you. Today, we will answer the question, who is a good candidate for migraine surgery? And I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bengaluru. Now, before we understand who is a candidate for migraine surgery, let us understand what is migraine surgery. Migraine surgery is basically a surgery done to decompress nerves in the face. A plastic surgeon found that a lot of his patients, after doing facial plastic surgery procedures, said that their migraines had stopped. This led him to investigate this. And he found that during plastic surgery on the face, we often release nerves. And it was these nerves that were triggering these people's migraines. And by releasing them, he was able to cure their migraines. And this is how the field of migraine surgery was born. So what this means is, those patients who have what are known as trigger nerves in their face are the good candidates for this surgery. What do I mean by trigger nerves? Well, the process of a migraine itself happens inside the brain. That's where you get that headache and that tiredness and not able to open your eyes and vomiting. But this migraine might be triggered by a superficial nerve. So a trigger nerve is a nerve in the face, and this nerve, when it gets irritated, that's what triggers the migraine. What can trigger it? Well, typically the nerve is being constricted or tightened by something. This can be a blood vessel, or it can be a muscle, or it can be a piece of bone, or it can be a fibrous attachment. There are a few common trigger nerves in the face. One is in the front like this, one is on the sides, one is on the back, and one is inside the nose. I myself suffer from migraines and I have a trigger nerve in the front. That's how I got interested in this surgery. So how do we decide whether you are a candidate for the surgery or not? There are a few things that we do before we undertake a migraine surgery. We don't rush into migraine surgery for every single patient. Firstly, we record a migraine log wherein we ask a patient to record their migraines for 2 to 3 weeks on an Excel sheet, and we have a detailed list of information that we want them to record, and this helps us decide if they have identifiable trigger nerves. Second, we can do a test wherein we give a local anesthesia injection into the trigger nerve when the patient is having a migraine, and if this gives relief, then they are a candidate for this surgery. Thirdly, we can do something called a Doppler test. That's where we see if there's a blood vessel near the trigger nerve. That's also a good indication that the patient might be a candidate for surgery. So these are all some of the things that we do to identify who is a good candidate from this surgery and who will benefit from this surgery. Now, how is the surgery itself? The surgery itself is not a very big surgery. Like I said, it's not a brain surgery, it's a skin surgery. It's done just under the skin. So, after identifying a trigger nerve, we make a cut near the trigger nerve and we release the trigger nerve from whatever is irritating it. These cuts are made in cosmetically hidden areas, so no one gets to know. We do them inside your hairline or in natural creases, so no one can make out that you had the surgery done. The surgery is under daycare. You come get it done, go home the same day. There's no admission or anything like that. There'll be a few small stitches that are removed after a few days. But by and large, most people are able to return to work within 3-4 days itself. Now, how much relief can the surgery give? In the rightly chosen patient, this can give a lot of relief. Studies show that 90% of patients get relief from this surgery. 45% get full relief, that is, they don't have migraines ever again. 45% get partial relief, that their migraines come down, doesn't go away completely, but it's less frequent and less intense than before. 10% don't get any relief, which means that they weren't candidates for this surgery, they did not have identifiable trigger nerves. Which is why, like I said, we don't do this surgery in every single migraine patient. We always check and make sure, and we convince that this is a good patient for this surgery before we undergo the surgery. And in those patients who get a relief, the relief can be dramatic. Just last week, a patient told me that he feels like he has got control of his life for the first time in 7 years because of the migraine surgery. He was suffering from migraines almost daily, and now they have almost completely stopped. He told me that he could never drive a car before. Now he's been able to drive cars for hundreds of kilometers without getting a migraine. So, as someone who suffers from migraine myself, I know what it feels like when you have a migraine and you cannot do anything. It's literally like a day of your life has been stolen away from you. So, in the right patient, this is a very, very gratifying surgery to do.
I tried all modalities of treatment available in market. I found one video, Dr. Aniketh on YouTube. So I contacted sir, I consulted him, and after consulting, sir said that you can be a candidate for surgery.
So we're glad you did. Now it's been only 2 days since the surgery. Are you feeling any difference right now?
Right now, I had no pain.
From past 8 years, I have a severe headache. I used to take tablet daily, but after the surgery, I reduced so much. I'm taking 15 days once now. I'm feeling so much better. I'm so thankful to you. Thank you so much, and I'm feeling better now.
And would you recommend our center to people who have migraine and recommend them migraine surgery?
This center is the only center which is currently doing migraine surgery in India, and I would definitely recommend it for people who have not been given fully relief by the medications.
So, this is a relatively new treatment in India. As far as I know, we at the Venkat Center have performed the first cases of migraine surgery anywhere in the country. And we are looking to help more and more people with this common problem. So, if you feel that you could benefit from this surgery, you have tried everything, nothing works, you're at your wit's end, do get in touch with us. We can even do a video consultation and do the migraine log process over video before we decide whether you can undertake this procedure or not. So, get in touch with us. Thank you. Have a great day.